Hello, my name is Ali Truckin, and this video is for Microbiology 205 at Arizona State University. And today I'm going to be talking about the disease tuberculosis. Tuberculosis is a lower respiratory infection caused by the bacteria Mycobacterium tuberculosis, and it causes symptoms such as the production of sputum, a cough, fever, and weight loss. The infection starts out as an asymptomatic lung infection, meaning that there are little to no symptoms at all. And our immune system does a really great job at controlling the infection from spreading any farther. However, it doesn't eliminate the infection entirely. The infection stays latent in the infected person's body for it can be for the rest of their lives if it goes untreated. However, they can lead a normal and healthy life for many years without any signs of actually having tuberculosis. Unfortunately for some, the infection can flare up later in their lives and cause tuberculosis disease, which a lot of people, they call it TB disease for short. TB disease is also known as the secondary or the active stage of the disease. It is estimated that roughly 20 billion people in the world have tuberculosis in the latent stage, and about 5 to 10% of those will develop the active form of tuberculosis later on in their lives. I believe that it wouldn't be as difficult to cure tuberculosis that when it is actually in the latent form than it would be to cure it while it's in its active form. The treatment for tuberculosis is very complex, and the patient is required to take medications for months on end. The patient must first take 4 different bactericidal medications for 8 weeks, and then after that 8 weeks is up, they must continue to keep taking at least 2 of those those bacterial antibiotics for another 16 weeks. So a lot of the times if they get a test done and the bacteria is still found in their lungs, it can take up to a year of taking these antibiotics until the tuberculosis is completely cleared out. So when TB is in its latent stage, it's inactive and it's not multiplying. So the medications can work on actually killing the bacteria that is in the patient's lungs. However, in the active stage, the bacteria is multiplying and it's more susceptible to spontaneous mutations. So the medication is going to have to work a lot harder to kill off a larger number of the bacteria than compared to how much bacteria would be there in the latent stage. And while in the active stage, the bacteria it can mutate, so it can become immune to those antibiotics. So what happens then too is the antibiotic will go in and it'll kill off the weakest members of those bacterial colonies, and once the bacteria mutates and it's no longer immune to the antibiotic, then those bacteria start multiplying and growing and taking over. There's also an ethical controversy on whether or not people who have forms of TB that are extremely resistant to antibiotics, if they should be in jail or quarantined until they're no longer contagious or they have the disease under control. If a patient is diagnosed with an extremely resistant form of TB, then they should still be able to lead their normal lives, because locking somebody up in jail for a disease is completely unethical in my eyes. They should, however, take the proper precautions to not transmit the disease to anyone else. So they could take precautions such as wearing a face mask, and that way it would contain any of the respiratory droplets that they might emit whenever they're coughing, whenever they are contagious. They should avoid flying for a while until the disease is less contagious, so they don't go overseas and transmit that disease to people who may live in a lower socioeconomic background than they, because it's a lot easier for the disease to spread when living conditions aren't very good. And they should also continue with any other antibiotics that their doctor might think will help them. Thank you.